Well, good morning, everyone. This is Keith with Positively Osceola, and thank you for being here again in one of our morning Daybreak live shows. Often you see Chrissy Hardy, one of our other hosts, but today you are seeing me. Hopefully, you'll be okay with that. But at Positively Osceola, we mentioned that we are certainly honored and humbled by the amazing guests that we are be able to welcome into our shows. And today, of course, that is the case as well. We are very excited from Orlando Health this morning to be able to welcome, and there she is right there, Dr. Anamaria Rodriguez with Infectious Disease at Orlando Health. How are you doing this morning?
Very good. Thank you. Good morning, and thank you for having me today.
It's an honor. And so I should probably talk a little bit about the fact that we are in the holiday season. So have you got all your shopping done yet?
I try still few things that I have to buy and some preparations for Christmas, but I think that at least everything that is for my daughter, that is the priority, is
Right.
ready for Christmas. Yes.
I've got some friends who were telling me last night that what they're buying for their kids, and their particular kids are still in the early teens. And
Mhm.
my wife and I, our son is 21 years old, and so everything is much more expensive now.
Yes, and like it was difficult to find certain things. My daughter is 3 years old, and actually her list change every week.
Right.
So every week we were trying to just look for like where to find the things that she wanted. But finally, she made her mind, and we were able to find it. Yes, but
Good for
definitely
you.
the supply is also low these
That's
days.
different. It's different this year for sure. No question about it.
Mhm.
So I see some people are popping on, so we'll want to get to the gist of the conversation here in a second. I'll see if I can find my video, and there it is. So we'll make it official, okay?
Okay.
Here we go. Awesome. So again, want to really thank you today and welcome. So with us today here at Positively Osceola and our Daybreak live show is Dr. Anamaria Rodriguez. Infectious disease is your focus, and so currently you're at Orlando Health, Dr. P. Phillips Hospital. But we'll start seeing you in the St. Cloud area at Orlando Health St. Cloud Hospital beginning in January. So again, welcome and thank you for coming this morning.
No, thank you for inviting me.
And so, again, we're super excited that you're going to be a part of the team, at least parts of the week over at in St. Cloud. It's certainly that is District 5 in Osceola County, by a lot the fastest growing area, certainly in Osceola County, and basically in Central Florida. So we're super glad you're coming out. Great facility in St. Cloud. It's an amazing team over there that Orlando Health has built. So we're certainly grateful. We're gonna get right at it. So I think if 5 years ago, had we been discussing this, it would have been a great conversation filled
Mhm.
with impacting, data for people to consider and to know and to learn. But given the last 2 years, basically with COVID, certainly the area your focus at the hospital is probably I can only imagine exponentially how much more busy you are now than you would have been even a few years ago. So let's get right at it, and um, let's just get a list of questions for you going so we can learn from you. So the question we hear a lot from folks at Positively Osceola is it too late at this point in the season to get a flu shot?
That is a great question, and I will say it's never too late during the season to get the influenza vaccine. And the reason is because we see the increasing of the cases during the fall and the winter, but it really peaks during between December and February. So even if you have the vaccine right now, you have a good protection for several months, because the influenza season goes on for several months, and sometimes we can see cases as late as May. So even having the vaccine right now, it will be provide protection for several months, and most likely from the months that we're going to have more cases and most likely most exposure to the virus. Ideally, we recommend to get the vaccine when the virus starts circulating in the community.
Right.
Will be between September and October, but we know that like a small percentage of the population really gets the vaccine as early as September, October. So right now is a good time, and as I told you, I don't think that is ever late to get the vaccine during the season.
It's kind of like my father always said, "What's the best day to plant a tree?" And his answer was 20 years ago. And I said, "What's the second best day to plant a tree?" Today. So if you haven't had your flu shot, do that as soon as possible. I have. I know my family has. We are in the public a lot, so we take that very serious. So given the last couple of years, again, is this flu season a little different? Does it compare to any other flu seasons prior? What's the look at this year as compared?
So this year, like, it's too early. We don't have like enough data to really compare with previous seasons. But what we can compare is with our previous season, that was 2020, 2021, that really was like a very unusual influenza season, because the activity of the influenza virus was very low, especially because we were in between the COVID pandemic. So that changed things in terms of the activity of the influenza virus in the during that season. So if we compare with that, maybe we're going to have more activity, because we're seeing like that now we have a COVID-19 vaccine. We are seeing that the measures that we were following to decrease the spread of the SARS-CoV-2 virus are like getting more relaxed. We see that like mask mandates are like not in place anymore. People, they are gathering, like planning also for like holidays, kind of different to the previous year. So maybe all those factors, having a different situation now compared with the same time last year, is gonna make those cases to increase. But as I told you, it's difficult to compare, because last season was like something that was completely unusual for an influenza season.
Sure. And so in that, what came to mind as you were saying that, I play during the holiday season, I play saxophone over at SeaWorld. And so looking back at last year, we had a lot of protection in place, a lot more mask wearing. Throughout most of the theme parks, you would see hand sanitizer. You don't see that everywhere this year, certainly some of it, but given that scenario. So do you think that that'll, even with less mask wearing, I think people are still having some of those protocols in place. Do you think that will help a bit, though, potentially, with still keeping it more of a quiet flu season? Do you hope that that's what will happen?
Definitely, because basically the mask or face covering, the physical distancing, hand hygiene, like staying at home while you're sick, are the same measures that we use to prevent other respiratory viruses. So most likely, if like part of the population continues following those protocols and continue following those measures to prevent the spread of the COVID, we are also helping to prevent the exposure to the influenza.
So do you think, with all the emphasis placed on COVID-19, it has not lessened in the media, certainly the national television level. We're, pretty much every day we're still inundated with it, which I think we should be, um, personally. So, do you think that people are more apt to be alerted to the fact that maybe I should pay attention to vaccines in general, get a flu shot for myself or my family? Are they more? Are you seeing people more aware of or reminding themselves, hey, I better take care of this? Or do you think it's getting distracted by the COVID-19 vaccinations?
I think that it has been like a way to remind people that you have to get your vaccines updated. We see in the outpatient, like most of my patients are coming and they're telling me, okay, I already got my COVID vaccine, my booster. Can I have my influenza vaccine? Or a lot of them, they're coming already vaccinated with influenza. I went to the CVS, to the Walgreens, to the local pharmacy. I got it with my primary doctor. So I think that is helping people just to like remind them that they have to get vaccinated to prevent other respiratory viruses. So
Yeah, again, I can only speak for myself. I know that I have had years in the past where I hadn't thought about flu. I wasn't aware of when the calendar was with that. But I was much more aware the last 2 years, and I did get vaccinated against the flu myself. Any shortage at all with flu vaccine? Are the supplies fine to go for people who are interested?
Actually, the supply for the flu vaccine depends of private manufacturing. So basically, we rely on those companies.
Sure.
But so far, there is not any reported delay in the supply or distribution of the COVID vaccines. Of the influenza vaccines. And what so far, what the information that we have from the CDC is that 167 million doses of the influenza vaccine has been distributed in the United States, and the private manufacturers were projecting to distribute up to 200 million doses of the vaccine. So that so far that has not been affected by the SARS-CoV-2 pandemic.
Gotcha. And just remind me, so when does the flu season typically start to relax a little bit as you move into, I know you said if you got the flu vaccine now, you'd still be enjoying at least a few months worth of coverage or assistance in that. So when does the season typically start to trail off a bit?
So we see like after February, when we are already starting to the like spring, is
Sure.
when we start seeing again a downtrend on the cases. But every season is different. So sometimes it can be extended a little bit longer, and we can see cases in late May. But the peak, it will be between December and February. That is what we usually see.
Well, personally, I'm hoping that myself, my family, and my friends don't experience flu at all this year. It's not a fun thing. I've had it in the past, so that's why I was motivated to get vaccinated. It's it's a quick thing, and it makes a difference for sure. So I know you've got to get back to your patients, but if you just had a couple more minutes, so what else would you share to the community? In the way of vaccinations. Obviously, we're mostly talking about flu today, but is there anything else you'd like to share this morning with anybody about this?
So I think that important points are that the influenza vaccine is recommended to everyone 6 months and older. So really, like, is recommended for like a big percentage of the population. The second thing is that the vaccine is the first and the most effective way to protect yourself and your family against the influenza infection. Other thing that is important is like right now in the middle of the pandemic, the symptoms of COVID overlap or are very similar to the symptoms of the influenza. So really, clinically, there is not any way that we can differentiate between both infections. So if you are feeling sick, stay home. Always just contact your health provider, get tested so we know which respiratory virus do you have. And of course, like continuing the measures that we're using to mitigate the spread of the COVID are going to be effective also to prevent the exposure to the influenza.
Well said. I would be remiss if I didn't take a few seconds just to say thank you. One of the things that we really are grateful for is to be able to talk to physicians like yourself and learn straightforward. There's so much information, certainly on the internet, on television, radio. There's just so much information that sometimes it's very challenging to know what is correct, how and which way we should act as a community, as a nation. How do you know what's correct? And the answer to that certainly is to go to the source straight up. And so we appreciate that you would share that with us this morning, because it really is about saving lives. It's about being healthy and making great decisions, and making those decisions based on real information. So I know I feel better about this morning, being able to learn from you. So I thank you very much.
No, thank you for having me, and have a great day.
And again, if you if you like some further information, certainly a great resource is, again, going straight to the source, and that is at orlandohealth.com. Just a great amount of information, great way to learn about what's going on, stay in touch. Highly recommend you do that. As you see the hashtag Choose Orlando Health, gotta love it. So again, I want to thank you for being a part of our show this morning, and that we have been with Dr. Anamaria Rodriguez over at Dr. P. Phillips Hospital. If you're in the St. Cloud area or even close, keep an eye out at the beginning of the year, because she will also be, her and her team will be over at the St. Cloud Hospital, Orlando Health St. Cloud Hospital, which is right on US 192. Actually, that is the medical pavilion. So that hospital's on 17th Street. Look for them in 2022. It's kind of scary to say that year already, but it's coming. So
yes,
I wish you a very, very happy holiday, and thank you for coming this morning.
The same to you. Happy holidays.
All right. Again, this is Keith with Positively Osceola, along with Dr. Anamaria Rodriguez from Orlando Health, together making a positive difference in and around Osceola County. Thank you.